I'm Mikael Mandano. I'm your physical therapist for today. How are you?
Good.
For verification purposes, can you state your name and birthday?
Pastis October 21.
Okay, so for today's, what we're going to do is we'll be checking your range of motion and as well as be doing your manual muscle test. For your range of motion, this is particularly important for us to have an idea if that area of your body is moving within the normal range of values. Now for your manual muscle test, this is important for me to have an idea of the state of your muscles. For example, if there are any weaknesses or any underlying conditions that I should take note of. So this activity will require me to touch you. Would that be okay, sir?
Yes.
Okay, good. So before we proceed with the assessment, I'll have to take your vital signs. This consists of your blood pressure, your pulse rate, respiratory rate, and as well as your temperature. So assuming na-take na ko sa vital signs ni patient, miss, we'll proceed na ko sa assessment. But before we do that, we proceed with the assessment is let's sanitize first. Okay. So first up, sir, is we'll be doing your range of motion test. So I have here my goniometer. So this is what I'll be using to measure the available degrees of motion in that area of your body. So for this test, is we'll be measuring ang motion sa imuhang ankle. So this is one, you dorsiflex, or in other terms, is kanang when you lift your foot up. So basically, what I will have you do is, I'll just have you sit there comfortably. I'll be placing this goniometer. So in placement of the goniometer, miss, fulcrum will be placed over the kanang lateral malleolus. Proximal arm will be in line with the fibula, and then the distal arm will be in line with the fifth metatarsal. So now, in this, miss, ako yung i-neutralize ang foot negation. So that's between the plantar and the dorsiflexion. So, okay, sir. This time, na-place na ako goniometer. What I want you to do is I want you to lift your foot as high as you can or until you reach your limit. Sige, sir. Okay, hold the position. Okay, good. Now, sir, keep that up and I'll passively move your foot, ha? Okay. Okay, good. Done to, sir. Relax. So now, sir, your measurement is 0 to 10 degrees, which indicates that it's within the normal values, both for active and passive to sir, 0 to 10 degrees imuhang measurement. So again, as I said earlier, within the normal values, you have normal values sa degrees of motion available when you dorsiflex or when you lift your foot until you reach your limits is 0 to 20 degrees. Now is we'll be doing your manual muscle test. So for your manual muscle test is we'll be testing your ankle area gihapon. So we'll be testing the muscles more responsible for turning your foot down and turning it out. So more ganani imong tiil, sir, turn mo pagawas. So for this, we'll be testing your right foot. So what I will do is I'll hold your kaning ankle. Now, sir, sir, kung instruct mo, sir, is please turn your foot down. Sige, sir, turn your foot down and then turn it out. No, sir, idungan na, sir. I-turn yung foot down and then ilihog pagawas. Okay. Ka-feel kag sakit, sir? Wala ra? Okay, relax, sir. Okay, this time, please do it again, sir. Ubos ng feel niya. I-turn outside. Sige, sir. Okay, good. One last time, sir. Down, then out. Okay, good. Relax. Okay, sir. So that would be it for your manual muscle test. So for your manual muscle test, we have a grading system. So this consists of grade 5, 4, 3, 2, 1, and 0. 5 being normal, 4 moderate, and katong 5 and 4 is able to resist kaning force nga akong i-apply, manual resistance. In this test, sir, is you fall under grade 3, which indicates na you were able to perform the action kato ako tikang gipa ubos sa imong foot and gipa turn it outside. So that's good. Na recontraction imong muscles. But the thing is here, sir, is dili ka maka-resist if ako ang applyan og kaning force, so dili nimo to ma-resist nga force, which is still good kay you're able to do the motion. So, that would be it, sir, for our assessment for today. But before I let you go, is I'll have to take your vital signs again to see if you're physically fit to leave the clinic. So, assuming ni-take na po agad sa vital signs ni patient, miss. Okay, sir, so that would be it. Thank you for your cooperation and thank you for coming as well. See you in the next session. So, paglakaw ni patient, miss, is kaning aftercare ko. And also, I'd like to take note lang, miss, nga, i-refer na pa-umbak ni patient aron na siya, like, proper body mechanics. Kay, I use this chair kay wala ko lain chair nga pwede madanggal ang foot ni patient. So, thank you, miss.